techniques in the mid-1990s, she has emerged as a pioneer in craniosomatic therapy. As a result of her clinical experience and research, she developed a new manual therapy technique called Facilitated Pathways Intervention, the topic of her doctoral dissertation. Flo now teaches this very effective therapy internationally in conjunction with other structural cranial techniques. Tonight, Flo is presenting her second speech. Her topic is one of her favorites, craniosomatic therapy. She is doing project number 3 from the Competent Communicator Manual, Get to the Point. This is a 7 to 9 minute speech, and her general purpose is speaking to inform. Tonight, Flo's topic is, what in the world is craniotherapy? Flo Barber Hancock, what in the world is craniotherapy?
Good evening. Thank you, Madam Toastmaster, members, and guests. Tonight I'm going to share with you one of my very favorite topics, cranial therapy. What it is, why it works, and what kinds of symptoms it can treat. You might have heard I'm a teacher, and we know the teachers love tests. So, and I don't want to disappoint you. So if everybody will take one of those little pieces of paper in front of them, I'm going to ask you a brief indulgence with a very short test. Just 2 questions. The first one just has 3 possible answers. Yes, no, or maybe. This little quiz does have a little bit of a twist, but right now, here's the question. If you had hip pain for more than a week, would you consider going to a cranial therapist, therapy on your head, face, and neck, to get rid of that pain? Yes, no, or maybe. Hip pain for over a week, would you go to a cranial therapist to get rid of that pain? Or to get that pain treated? That's it for now. Question 2 is going to be at the end. Cranial therapy in the U.S. is considered a complementary therapy. It's one of a very large group of therapies that are considered complementary and outside of mainstream medicine. That means it's generally not covered by insurance, unfortunately. Cranial therapy is techniques done primarily on the head, although sometimes there's a little elsewhere. And 2 different approaches were developed in the 1930s and 1940s, one by a chiropractor, one by an osteopath, and they kind of caught on and were taught in osteopathic colleges in the 1940s. They did not really develop a lot of popularity, although there was some use of them. And in the 1980s, the mid-80s, there was kind of a popularization, so it started being picked up and used more and talked about more. The work that's done very light touch, like 5 grams of force, is one approach, and that's sometimes called craniosacral. So if you've heard the word craniosacral, those people are talking about a type of cranial therapy. What I'm going to be talking with you about tonight is what cranial therapy is. It's a manual therapy. It's done just with hands and normally just on the head. And it can be from very, very light, just like a feather, to firm-handed, like a firm handshake. And the techniques I'm going to be talking about tonight mainly refer to craniosomatic therapy, which was techniques developed by my husband back in 1989. And he has built on those. And then in about 1997, I added in my facilitated pathways work, which is also done on the head, face, and neck. It's a different kind of therapy, but still a cranial therapy. So why would touching your head, face, and neck help your spine, your hips, or even your arm or your leg? Well, it's kind of like that old song. In a nutshell, the hip bone's connected to the backbone's connected to the neck bone, and the neck bone's connected to those head bones. That's really the whole story, but without a lot of detail. So, I'll say a little more. For starters, your head has 28 bones. think it's like a big bone and a jaw flapping, but it's really 28. We can only really affect 22, the 3 and 3 in the inner ear, not so much. So of those 22 bones, they're supposed to stay mobile. And when you're little, a baby, a young child, those bones generally are very mobile. But as we add years, our cranial bones move less well. And that's when the trouble starts. That's when things like hips go out. Because these cranial bones are, for many of them, are related to specific bones in your body. A bone here relates to this. Down the middle of your head, there's things that relate to your spine. So when your body doesn't move as well, your cranial bones don't move as well. And when your cranial bones are kind of stuck and that fascia and stuff up there is tight, then your hips and legs and knees might not move as well either. So if we look at some specifics, 3 out of the 4 balance mechanisms for the body are located in the head. The little semicircular canals in your ears are really, really important for balancing, which probably many of you know about. But those temporal bones that enclose the ear should also be mobile. And if the temporal bones have more mobility, then the little balancing mechanisms in your ear can also work better. And then there's about the eyes. We don't often think of our eyes as a balance mechanism, but if you've ever tried to stand on one foot and then close your eyes, you'll find out real quickly how important eyes are for most people for balance. And if the bone that those eye muscles attach to, which is here, if it's not moving very well, then that can affect your visual writing mechanism. Because the brain has told the eyes, stay level with the horizon. And they can have a hard time doing that if this little sphenoid bone in here is hung up and not moving well. And then there's 4 little pair of muscles back here in the back of your head, right where your head attaches onto the 1st and 2nd vertebra. And those four muscles, 8 little guys have like 2 to 5 times as many special nerves talking to the brain about how your head is positioned on your neck. And that feedback is really important to how not only your head tips, because your head tips affects your spine, and your spine affects the sacrum, that flat bone at the bottom of your spine, and that's where your hips attach. So what's going on here with your head sitting on the top of your neck is a real direct influence on your spine and on your balance. We can talk a little bit, but real briefly, about what cranial therapy can treat. Craniosomatic therapy in particular. We call it craniosomatic because cranio is head, but soma is the rest of the body, the soft tissue. And we especially talk about the muscles that attach to bones and move bones. We can treat headaches. We can treat jaw pain. Craniosomatics can also treat golfer's elbow, or bad hips, or posture that's really in trouble. The list is really long, and I'd go way over time if I tried to give you the whole list. So let me just note that not only can we help bones and movement, but we can also affect things like how the body calms down. So we can help children who are hyperactive. We can sometimes help the digestive system and swallowing, because the vagus nerve is one of the 12 cranial nerves, and that vagus nerve is supposed to keep the whole body calm and quiet. And that includes your swallowing and your digestive system. So it can even affect things like acid reflux. So, the summary is how well your head bones move and how well your head sits on top of your neck has a whole lot to do with how your body functions, how you balance, and how you move through space. And the list of symptoms is not endless, but it really is very long. Sometimes we can be surprised by new information. I hope I've given you a little bit of new information tonight. And that small paper in front of you, put a number 2 on it, please. And here's that second question. If you had hip pain that was really bothering you for over a week, would you think about going to a cranial therapist to get it fixed? Yes, no, or maybe? That's all. I hope you changed your answer. It was towards positive. You've just graded the teacher. Thank you very much for your attention.
Delightful and informational speech. Thank you, Flo. If I could have 90 seconds, Mr. Timer.
Clock's running.
You can fill out your love notes and give feedback to Flo, what you thought about her speech.
Is there an all-chew counter in the room?
And do we have someone that could walk the basket around and collect the love notes? Thank you, Mark. Our second speaker
Mark,
this
I mean-
evening is Maria Gadari. She will be speaking for 5 to 7 minutes from the Competent Communicator Manual, speech number 3, Get to the Point. Maria is an instructor at the Ultimate Medical Academy. She's a busy mom of 2 children. She's been a member, not that long, since November of 2015, but she's chugging right along with her speaking. And I have had the privilege of being her mentor. And she's just a fabulous person to get to know. If you have a chance to visit with her, go for it, because she's just wonderful, personable, and she has an amazing story where she has overcome adversity in her life. The title of her speech is, What is Your Favorite Animal? Maria Gadari, what is your favorite animal?
Sandra, what's your favorite animal?
My cat.
Okay. What's your favorite color?
Green.
Green. Nice. A few weeks ago, I was asked, what is your favorite color? What is your favorite animal? I said, my favorite colors are black, blue, and purple. Yes, they're dark colors. I said my favorite animal is a butterfly. I get this weird look. But butterflies aren't animals. Technically, they are. They're just not mammals. Oh, okay is what I get. So, she asks me again, so what is your favorite animal and why?
Thank you.
I answered your question, Freddie, but why? Butterflies are a sign of spiritual growth, I tell her. Her eyes just open. Wow, I didn't know that. I go on to tell her, the animal embodies the principle that there are times in life where the past must be done away. So with that, a new life can begin. Wow. Okay. I asked her, why do you want to know? I'll let you know in a couple of days. But what do you think I should like? I see you as a giraffe. Okay, as a giraffe. Okay, why? I'll let you know in a couple of days. Madam Toastmaster, fellow Toastmasters, distinguished guests. A few days later go by, and this young lady hands me this picture. She has colored this giraffe. Coloring to her is something very peaceful to her. When she is stressed out, this is what she goes to do. She gave me this picture, and I'll pass it around, along with some background information about a giraffe. She says, take this, this is for you. This is what I see of you. Read the information and get back to me. Well, I did that. And there's a few things that I got from it. One, giraffes are like messengers. It encourages us to elong our vision, stretch ourselves, and reach as far as we can. They often make appearances when needing a little reminder that we are grandiose beings with potential, with remarkable potential to rise up to challenges. It also ties into communication, encouraging to make words count. Be strong with your voice. Be effective with your words. Second, giraffes demonstrate grace and strides, like striving through challenges while maintaining balance and grace. Third, they remind us of vision, long-reaching, far-seeing kind of vision, focused on the horizons. Giraffe people have the ability to see into the future or see the big picture. They also lend intuitive insight when blinded by life's distractions. What about their eyelashes? Their eyelashes are symbolic of protection. It keeps out debris. It can mean that visions are protected by the wisdom of nature. It helps with gracefulness in actions, patience and structure, and sturdiness in life's rocky terrains. Lastly, did you know giraffes have 3 horns? One on each side. And there's one horn called the ossicones. It's called the 3rd horn. It sits right between and just above the eye. It's also known as the 3rd eye. This symbolic 3rd eye talks about intuition, dedication, perception, and heightened sensory awareness. Now, after I read this, I can see how she sees me as a giraffe, although giraffes are tall. But these things, as an instructor, I have to help these students see past their hurdles. I have to keep them engaged in the classroom. I have to be there to listen and communicate with them. I have to communicate certain procedures with them and how to really overcome their fear when it comes to having to, draw blood. And I tell them, if you cannot draw blood, this is not the field for you. So I ask you, what's your favorite animal? What's your favorite color? Because for me, it's still a butterfly. Butterflies are still animals. But after that, I can see that my favorite animal is a giraffe now. because of that. Thank you.